The wrestling match is going to be about steroids in community-acquired pneumonias, yes and no. And I would like to introduce Dr. Imron Subhan, who is an emergency physician and the director of the emergency department in Apollo Hospitals in India, in Hyderabad. He has 13 years of experience in emergency medicine and has been doing a lot of work in emergency medicine in India, in addition to being a regional faculty for the AHA. So he's going to talk to us about the steroids in community-acquired pneumonias, the yes part. So please, Dr. Imran.
Some debates are quite silly. We had decades of debates on crystalloids and colloids. We still have debates going on sepsis, early cold-directed therapy, whether it's good or not. I've seen hospitals, as soon as one research paper comes out, they stop the treatment instantaneously. This happens with sepsis because it's a personal specialty which I like. And every time a new paper comes and a debate happens, people change clinical care within the hospitals instantaneously based on certain papers. Steroids in community-acquired pneumonia, this is again a debate which has been going on for quite some time. It's been for about 60 years, according to some of the articles which I have seen. There is still no consensus on steroids in pneumonia. The decisions even today are being taken on case-by-case basis, whether this patient is having an alternate requirement to administer steroids, like asthma, we'll give that to him. They are looking at other chronic conditions which pre-exist, then taking a decision whether to give steroids or not. And steroids are added to a lot of ICU patients. And the rationale, primarily the rationale to administer steroids has been to reduce inflammatory response to pneumonia. Now, I'm not a researcher. I am a clinician. I work as an emergency physician. I want to see what's available on this so that I give the best care to my patients. So I just look into textbooks. I look into some of the protocols. I look in some of the reliable studies which are there to help me take this decision whether to give steroids or not give steroids. So there were a lot of papers which are there. There's a lot of evidence which is there on this particular topic on both sides, and yes or no. So I just looked at what is the best research I can get. Now, I did not look in as if I'm an academician or a research person, but as a clinician. So the three papers which I looked, one of them was quite good. This is Van et al. There were about 6,000 patients which were seen. This was a meta-analysis which was done. It showed reduction in hospital stay and ICU stay both when steroids were administered in community-acquired pneumonia. It showed reduction in the duration of antibiotic treatment in the hospitalized patient. It had no increase in adverse events related to steroid, which is bleeding and hyperglycemia. There was no increase compared to the other group. So they concluded that short-term treatment with corticosteroids is safe and may reduce the risk of ARDS, shortening the length of disease in patients with CAP. And this was a recent paper. Now, I looked at another one, so just to see how much of evidence will be available. Now, this paper also was a recent one. It showed reduction in mortality again, reduction in need for ventilation, that was reduced. There was no increase in hyperglycemia and GI hemorrhage. Again, there was no increase in any adverse effects. So adjunctive corticosteroids therapy was safe and beneficial in severe community-acquired pneumonia. Now, these patients were hospitalized. That is a probable limitation, but it is still showing that it was useful in this particular case. I looked at one more, just to be sure about it. This was done a little earlier in 2015, Annals of Internal Medicine. This showed, again, this was a meta-analysis, systematic review, showed reduction in mortality out of 12 trials, reduction in need for ventilation, reduction in incidence of ARDS, reduction in duration of hospitalization. So I am concluding that a short course of steroids is unlikely to cause any clinical deterioration in patients with community-acquired pneumonia, and they are proved to be useful and beneficial in severe community-acquired pneumonia. Now, when you have information like this, why are we restricting corticosteroid use, just because every day there are new papers coming in. I don't think we should restrict this. We should restrict if there have been severe adverse effects and patient mortality, morbidity has been reduced. But when it has not been shown, then I don't think we should be restricting good treatment or good drugs from patients who need it. So this was a short analysis, so thank you.
Our no side is Dr. Danish Sami, a consultant physician in Al Mafraq Hospital with a 12 years experience in emergency medicine, and he's going to debate the issue of using steroids. So let's go for it.
All right, thanks very much. Okay, so now this is the real talk, so you can forget about what happened in the last 7 minutes. What is pneumonia? Pneumonia is an infection. Yes, we all know that. So you need antibiotics for this? Everyone agrees with that? Absolutely. It becomes a problem when there is an immune response from the body. And it makes sense because steroids depress the immune response. So it makes perfect sense to give steroids in pneumonia. Well, I don't seem to be like promoting, the no part of it, but it makes sense to me that we should be giving steroids to reduce the immune response. You get the research response, which can start to affect your kidneys, it can start to affect your heart, and the rest of it. Well, let's have a look where the steroids are useful. That's my midlife crisis of going to the gym and trying to build up my muscles. And I realized there were like really cool guys in the gym who were doing so well. And I made a friend with someone and who said, well, yeah, what you've been doing, he's been injecting steroids. And that's where steroids are more useful. When I was a resident and I was learning about pneumonia, my background is from, clinical handbook of, Oxford Handbook of Clinical Medicine. We had the Praveen Kumar for clinical medicine. We went through Davidson, Tintinelli, most of you study here. We have Rosens. I don't recollect as a medical student or a junior doctor thinking about pneumonia and steroids. It was all about antibiotics, cultures, and fluid resuscitation. So I looked at the current evidence. I looked at the British Thoracic Society to see what they are suggesting in an internationally recognized society about this evidence. Now, this is their flow diagram, which talks about what we should be doing. They introduce us to the CURB 65 score. We all know that. We all know that, how to treat different scores of CURB 65, the high severity ones. But BTS does not talk about steroids anywhere in their literature as a recognized treatment at any point in time. But they added something in 2015. This is their update. And if you look at it, it's only in the critical care management of community-acquired pneumonia. Their recommendation at the moment, as it stands today, is that steroids are not recommended in the routine treatment of high-severity community-acquired pneumonia. I thought I've been naive about just British Thoracic Society. I will have a look at the NICE guidelines. And they seem to be agreeing with the BTS. Do not routinely use steroids. Look at the Cochrane. And their recommendation at the moment is that there are plenty of randomized controlled trials, but the evidence is not strong enough to be using all this. Well, we live in a world of fake news. We've been hearing about fake news a lot recently. And this is where it all started when we started looking at steroids and septic shock. But even that paper by Anane, where all the debate started, does not show that the p-values are not significant, though they adjusted it, but that's not what you do with a randomized controlled trial p-values. You don't adjust them to make your results significant. There are plenty of meta-analysis, as my colleague said, but if you look at the collective evidence, there's nothing in favor of steroids. So nobody is actually commenting that, yes, you should give it in pneumonia, though it appears to be safe, but does not reduce 20-day all-cause mortality. My colleague talked about this paper. Yes, corticosteroid therapy for patients with community-acquired pneumonia, systemic review and meta-analysis. Even their conclusion is, it does not reduce the mortality, so why we should be giving it. There's an ongoing trial about it, ESCAPE trial, which is coming out. The primary outcome is 60-day mortality. That's something to look forward to. So there is an ongoing debate about it, that whether we should give it or not. So this is an ongoing, it's the first large-scale prospective randomized controlled trial evaluating whether or not this treatment improves recovery. Any questions? Just to summarize, the jury is still out. All the recommended bodies say we should not be giving it. There is some evidence to support, I'll take your question in a minute. There is some evidence to support routine use of steroids in pneumonia. However, the quality of evidence is poor. And at the moment, there is no international guideline promoting its use in the emergency department. Thank you very much. I'll take your question if you have. Yeah, absolutely. I mean, there is some evidence of, we all know the side effects of steroids being gastric ulcers. We all know about, other immune responses being developed in the body. However, there is no good evidence that steroids use increases side effects. Generally, none of the papers that I've gone through or the international evidence that I've looked at, they are not saying that you should not be using them because of the fear of the side effects. What they are saying is that there's no good evidence at the moment that it reduces mortality. That's what they are saying just now. We don't know because there's no good evidence. And if the evidence is there, what the paper we talked about in the previous talk, there is evidence, but it's not a good quality evidence because the results have been tempered or they have been shown in a way for them to look more effective. But in fact, at the moment, as we stand today, none of the international bodies are saying, yes, we should use it. So I'm afraid it's a big no from my side.
All right, excellent.
Thank you very much. Thank you.
Thank you very much for an excellent debate of a no. Anybody in the audience is using steroids nowadays for pneumonias? No? Okay. All right. So, anybody will use it? Well, okay. It's a compelling evidence. All right. So we had some time to spend with the difficult debate.